This oversight hearing is not about numbers, it is about lives. The time for excuses is over. It is time for real change, and it starts with management.
Committee Chair on Health, Senator Sabrina Salas-Matinani, making a firm statement heading into the oversight hearing of the Guam Memorial Hospital Authority. Seated before lawmakers were GMHA officials and Public Auditor Benjamin Cruz from the Office of Public Accountability. Notably absent was GMHA Hospital Administrator and CEO Lillian Perez-Posadas. Speaking on her behalf was Dr. Kwazi Naomi, Associate Administrator of Medical Services. To start things off, Cruz presented Part 1 of the GMHA audit on physicians' pay. He said the audit was simple, despite being over 100 pages long and full of numbers. It breaks down if GMHA complied with applicable Guam laws, rules, and regulations in their hiring process of contracting physicians.
Our findings: 1, the claim at GMHA was that GMHA physician hiring was not subject to Guam procurement law. However, according to GMH, it was governed by its own internal regulations. 2, we found that there was a lack of general or specific internal policy to govern the contracting, hiring, and documentation process of physicians.
GMHA addressed some of the issues and deficiencies they found with the audit. Rodelyn Gerardo is the Assistant Administrator of Operations.
You'll see that vendor 203 and 265, you'll see data across from fiscal year 2020, 21, 22, and 23. However, when they combined it, you'll see that their fiscal year 22 and 23 show 0.
Gerardo concluding her portion of the presentation with GMH's issue with the type of evidence the audit used.
They didn't go to GMH, so they didn't physically observe, they didn't physically inspect, right? They got the documents because we sent it to them via email, but part of the auditor's role or part of the procedure normally would be that when you conduct field work, you would go to the entity, you would observe, look at different things, interview people, and so on. So it kind of begs the question, how did they come to certain conclusions?
Chiming in was GMHA Legal Counsel Jordan Paulin on one of the policies OPA cited relative to personnel administrator contract processes.
We have a separate dedicated office, the medical staff office, that handles our physician recruitment, hiring, peer review, privileges, the whole gambit of physician support. So what the OPA missed in relying on the contract for human resources is that applies to the rest of the hospital, but physicians have largely been governed as unclassified appointments and we've used a historical hiring practice for them. What that is, though, is with that policy that was relied on, it was cited in the final draft report without ever questioning or coming and speaking with the medical staff office that actually deals with and addresses these issues. So there was a lot that was just missed in making assumptions.
GMHA Chief Financial Officer Yuka Hechanova says they did invite OPA numerous times to gain a better understanding of policies.
Here's a doctor. How do you get him on a contract? How do you find the doctor? How do you onboard him? All these questions that you can ask directly to the people that are responsible for this process. We don't have anything to hide, honestly. Then I think we would have had a really good constructive audit.
The oversight hearing was 3 minutes shy of 4 hours. Jonagan Charfris, KUAM News.